from India and elsewhere. It's my pleasure to welcome you all to the webinar entitled COVID-19 in India, Voices from the Field, sponsored by Johns Hopkins India Institute and Center for Global Health. I am an associate professor at Johns Hopkins School of Medicine, and my name is Dr. Vidya Mave, and I also direct a large Indo-Johns Hopkins clinical research program in Pune, where I live full-time. I'll be moderating this webinar along with my co-host, Dr. Brian Wall, an associate scientist in the Johns Hopkins Bloomberg School of Public Health, who lives primarily in New Delhi and manages a large public health project in Uttar Pradesh. As many of you know, India ranks second in the absolute burden of COVID-19 cases globally. And as of today, 25.5 million people have been diagnosed with COVID-19. Of these, over 380,000 cases have died, making India to have third highest deaths in the world. India's first wave in the year 2020 was generally more manageable, but India's crippling second wave that commenced in mid-February of this year made headlines in both Indian and international media in the last 3-4 weeks, as there were more than double of the incidence cases as that of the first wave. And there was a huge demand for hospital beds, oxygen supplies, and ventilators, and so on. Following the decline of cases, daily cases in the last 7 to 10 days, the headlines have gone. But the crisis is not over yet. The rural India is currently being hard hit, and a third wave is expected. A large national and international COVID-19 relief efforts are ongoing, and with 60 countries, including the United States, contributing to this COVID relief effort. In that direction, Johns Hopkins India Institute has formed a COVID-19 India task force. Many Johns Hopkins faculty, staff, students have volunteered their time, talent, and also raised funding to assist many existing and new India-based partnering institutions in their COVID relief efforts. Dr. Brian Wall, my co-host, will provide a brief overview of the Johns Hopkins India Institute and its COVID-19 task force. Dr. Brian, over to you.
Good evening, everyone. Good morning, everyone joining from the US. And thank you, Dr. Mave. If I could ask to move the slides back to the title slide, please. So my name is Dr. Brian Wall, and I'm an epidemiologist based in Delhi. Next slide, please. So Johns Hopkins has been working alongside many partners in India since as far back as the 1930s. Our university has a deep commitment to supporting a range of public health efforts in the country. And through the recently established Johns Hopkins India Institute, we are formalizing and reinforcing this commitment to India. Next slide, please. The mission of the Johns Hopkins India Institute is to mobilize the Johns Hopkins faculty, staff, students, and alumni to work with partners in India to improve society through research, education, policy, and practice. We look forward to continuing this work with many of you through 3 main strategic directions: catalyzing and strengthening new ideas, partnerships, and knowledge sharing, promoting interdisciplinary scholarship and training, and leveraging local, international, and institutional resources and partnerships to expand and deepen research, education, policy, and practice. Next slide, please. In response to the ongoing COVID-19 crisis in India, the Johns Hopkins India Institute constituted a task force to improve awareness and coordinate activities around advocacy, technical collaboration, humanitarian assistance, and also to identify opportunities to address the COVID-19 pandemic in India. And this, again, is for faculty, staff, students, and partners working in India. You can see here the structure of the task force, which is chaired by Dr. Amita Gupta and co-chaired by Dr. David Peters. We have 6 core areas, including technical collaborations, and analytics and policy linkages. Next slide, please. The task force has received more than 450 gifts and raised more than $1 million. This generosity has enabled the India Institute to support several efforts across the country, primarily through our long-standing partnerships with a range of different collaborators. We want to take a moment to thank everybody who has donated, and as Johns Hopkins faculty members, we are floored by the tremendous support from the Johns Hopkins community. As Dr. Vidya mentioned, the current crisis is no longer making international headlines. However, the hard work of our partners and several others in India continues. The pain and suffering will also continue for weeks and months to come. And it's for this reason that we wanted to give an opportunity to our partners to tell us about, and the world, about the ongoing activities and to get their perspectives on some of the remaining challenges. To those in India or with family and friends in India, we want to offer our thoughts and solidarity, and we hope everybody joining us today is managing the best they can during these difficult times. Before we get started, just a little bit of housekeeping. We've asked everybody to introduce themselves in the chat. However, to help make it easier to moderate questions, please include all questions for panelists in the Q&A. I will also be monitoring time and asking our speakers to keep to the time allocated to them. And so with that, I will ask Dr. Vidya to introduce our first speaker.
Thank you, Brian. Our first speaker is Mr. Raghukul Ratan Pandey, who is a senior research officer with the Johns Hopkins Bloomberg School of Public Health based in Lucknow, Uttar Pradesh. His work primarily focuses on supporting the government of Uttar Pradesh in health system strengthening, planning, and policy at every level of governance. And he has had about 21 years of experience in this field. Dr. Raghukul, please go ahead.
Thank you, Dr. Vidya. Good morning and good evening to everybody. Thank you for giving this opportunity to share my experiences with COVID-19 and the ongoing response in India's most populous state, that is Uttar Pradesh. I will try to also share some of my personal experiences, as during this April, my whole family was positive, and I lost a couple of my family members during this second wave. So I myself, Raghukul Ratan Pandey, I am basically an infectious disease epidemiologist. As Dr. Vidya Mave said, I worked within the government health department for more than 21 years at almost every level, starting from the village up to the top level. Currently, I am working with Johns Hopkins University since last 2 years on the strengthening of health system in Uttar Pradesh, even before the start of the current pandemic in last year. As in many settings in Uttar Pradesh, there is an acute shortage of trained human resource for health, well-equipped health infrastructure to manage the health emergency. Dominant and unregulated private sector is there in the state, and up to some extent, somewhat fragmented health system. By saying that fragmented health system, I mean there are two different departments in the state. One is managing the tertiary care and another is managing the secondary and primary care. So nevertheless, JHU is providing technical support to the government of Uttar Pradesh to address some of these key challenges for last several years. During the first wave of the COVID-19 in 2020, we worked with the government of Uttar Pradesh very closely to analyze and assess the preparation for and response to the COVID-19 in Uttar Pradesh. And we observed that the state responded quickly to manage the epidemic by, among many other things, establish sufficient COVID-19 hospital beds and rapidly increase the testing facility across the state. I mean, given the large population of approximately more than 232 million people, cases and deaths could have been much worse during the first wave if could have not been managed properly. For the second wave, in my opinion, the state could not anticipate the magnitude and the severity of the second wave. Dedicated COVID care facilities established during the first wave, we are being denotified in the month of January 2021, assuming that the COVID-19 has declined from the state. Understandably, in the setting like UP, difficult decisions need to be taken when COVID-19 cases are low and resources could be used for other pressing challenges. In addition, general COVID prevention protocols like social distancing and universal masking, we are not being adhered properly during the most of the first quarter of 2021. April 2021 proved disastrous for UP, in my opinion, especially for some big districts like Lucknow, Varanasi, Meerut, Prayagraj, and second wave looked more like tsunami than a wave. The public health system was overwhelmed and almost completely exhausted. There was acute shortage of ambulance, beds, oxygen, ventilators, and some of the critical medicines. Unfortunately, a sizable proportion of doctors and paramedical staff also got coronavirus infection, and that hampered the clinical service in a big way in the state. Remaining staff were very hesitant to visit the ward due to fear of infection, and thus inpatient were waiting for hours to get the medical attention because no one was attending them. Patients were roaming from one hospital to another hospital in pursuit of the beds, as there was no information of the bed availability at all. Or if there was any, then the process to get a bed was very complicated and lengthy. Private sector, as I told you, totally unregulated. Private sector hospital, we are unregulated, and many of them we are over-exploiting the patient in this crisis, despite capping a price by the UP government. People were helpless and had to opt home isolation, even if their condition was not suitable for this. Many people were forced to move a small district with the low case load to get bed to save their lives. General public health measures like zonation for containment of the infection, contact tracing, and testing proved difficult due to exploding case load in these big districts, and that further aggravated the situation. Accessibility to the testing and test result was often delayed by many days, and that also spoiled the situation. Many people died undiagnosed. I personally witnessed queue in crematorium at many times during the month of April 2021. However, in response to that, the government of Uttar Pradesh started to establish many makeshift hospitals with the help of DRDO and some private organization, and tried to ensure regular oxygen supplies through the oxygen train, carrying from different part of the country, as well as establishing oxygen generation plant in big hospital, procurement of the oxygen concentrator. The peak of epidemic has started to decline in the big district, but the some of the small districts are showing a rising trend now. And mind it, it is of great concern as the health infrastructure in these districts is not well equipped to mitigate problem of such magnitude. Thank you. I will stop here.
Thank you.
Thank you. Yeah, go ahead, Brian. So please introduce our second speaker.
Yes, thank you, Raghukul. I know the last month has been difficult for you, and of course we offer our thoughts for you and your family. It's my pleasure to introduce Krishnan, or Krish. He's the Chief Operating Officer at YRG Care. His primary areas of work are stakeholder engagement for implementation research, program delivery, and administrative support to the board functioning of YRG Care. Together with Krish will be Dr. Pradeep, who's licensed to practice medicine in India and currently serves as the Chief Medical Officer at YRG Care and oversees all clinic and clinical research services at the organization. Dr. Pradeep has served as a study physician on ACTG protocols at the site. And over the past decade, Dr. Pradeep has been invested in investigating the interaction between HIV, viral hepatitis, and drug abuse. So Dr. Pradeep and Krish, on to you.
Thank you, Brian. Good morning and good evening to all. So at YRG Care, we've been actively involved in both diagnosis and treatment of COVID right from the beginning. We do both outpatient and inpatient care, including teleconsultation across India, which also includes some remote places. And we also have a case from Nepal, which we managed through teleconsultation during this pandemic. Though it's challenging, the teleconsultation, but it's greatly satisfying to see more than 90% of patients do well with just good home care. We have multiple calls ever since the vaccine drive started, especially from people living with HIV, on if they can safely take the vaccine, which is better, whether Covaxin is better or Covishield is better, or if they have to disrupt ART during vaccination. Most have been told actually by their hospital or doctors near their hometown that they can't vaccinate and they would have a poorer COVID outcome. There is so much misinformation about people living with HIV and COVID. For example, one patient who was recently diagnosed with COVID, they got in touch with me, who was also HIV positive, was managed just with the cetirizine and paracetamol. She did well and she recovered without any problem. But she was very highly unhappy that she wasn't given any COVID meds. Even after she recovered, she pestered me to give her some COVID meds to make sure, COVID was out of the way. So the other big challenge with PLHIV is also to make sure that their medications don't stock out during this pandemic. So we actually run active courier services. So most patients are asked to do a CT. The other big problem that we face is most patients are asked to do a CT right on the first day of infection to help decide on home quarantine. And this is also a practice which has also been done in the government sector. So most of the people do their scan, they're very happy that they're doing well, and suddenly ignoring most of their primary symptoms. And only when the disease becomes florid, they come back to our care, which again is difficult to manage. Not enough, can you switch over to the next slide, please? Sorry. Not enough, we have to face the above problem. We also have to deal with news articles on unscientific, baseless, and biased practices being regarded as a means to end infection, like the ones I'm showcasing here, where we have these medications which are doled out like as if, these are medications which are going to end the COVID pandemic. At the IP care, we have a completely different ballgame. We have a total of 8 ICU beds and 66 oxygen beds at our IP. Most patients who occupy the ICU generally take an average of 5 to 10 days before they get better. So getting ICU beds for new patients is a big challenge, and escalating care is also a challenge. There are some who occupy the beds and refuse to go even after they are better. So that is something that we don't know what to do. So my biggest concern is the irrational use of steroids among all of this and other medications. There are most of them who are started on steroids quite early, even next slide, please, sorry. They're started quite early on steroids, pretty early, even on the first day, along with 2 or 3 antibiotics. These are some of the prescriptions that I've shared with you, where you can see even on the first day, people being pumped with so many antibiotics, so many antiviral agents, and it's crazy. Can you put the next slide, please? So this is a prescription of a patient from a hospital and pretty much covers everything that you have heard or experimented on for COVID, except for the monoclonal antibodies. So this is a big challenge for us. Also, doctor shopping for treating their illnesses results in patients ending up with multiple prescriptions containing the same generic medications. These are some of the challenges I wanted to highlight. Thank you all for your patient listening. Rich, over to you.
Hello, all of you. This is Krishnan here. I look at the community engagement part of the COVID relief at YRG Care. And I would like to begin by thanking Johns Hopkins India Institute for their generous support. They have supported us with rapid antigen testing in Thane, which we are about to start in Maharashtra. We are also being given support for RT-PCR testing and 1,500 vaccination shots. So we are very grateful for the support, and we would like to just assure you that we started this work in 2020 during the first wave of COVID. So this is when we started the community fever and SpO2 assessments. Next slide, please. So these are the medical camps that we conducted in different high density locations to help public understand if they have symptoms and then to link them to the government program. The next one, please. Next slide. And this is the slides where we are showing we've done face masks and herbal drink that government made it mandatory last year, but it's withdrawn now to the community groups that we actually distributed across the city. Next one, please. And we also provided nutritional support to patients and their families. The next one, please. This is the food distribution, nutrition support to children and orphan and vulnerable children program that we run. The next one, please. This is the awareness program that we conducted across different venues where there was a need for COVID awareness actually. The next slide, please. And we are also conducting a survey among, it's actually a surveillance study among people in Chennai to try and understand the level of COVID that exists that people have still not come and access healthcare from. This is a home-to-home survey actually. Next slide, please. And this is our people in action conducting the survey and sample collection. The next one, please. During last year in Telangana, we actually did door delivery of ART during complete lockdown, and we actually delivered over 17,000 individual deliveries across 5 districts in 3 months. These are some of the shots there, and people are exceptionally grateful that we were providing the medication at the door, and we were running a call center and we provided the support to them. The next one, please. And this is the next. This is just deliveries that we did at different locations, and we've just masked people because we did not want identity of these people to be known. So with regard to the wish list that we ask of JHIA or any potential sponsor, you will be surprised to know there is still a lot of need for basic stuff like masks, sanitizers, because we work with most vulnerable population, people who inject drugs or men having sex with men or orphan and vulnerable children, and we find there's a big need for basic supplies like masks, sanitizers. In fact, I will also request that a home response kit comprising of masks, sanitizer, and over-the-counter medication that Pradeep always says that is required rather than people rush to hospitals, and also pulse oximeter. And these are most needed at this point in time. And of course, I will also request for more rapid antigen testing because we find the numbers are increasing rapidly. We'll also be grateful if video consulting unit is set up for us so we can link Pan-India for other clinicians to work along with our team. Thank you so much for your attention.
So thank you, Dr. Pradeep and Krishna. That was a fantastic work you're doing on the ground in Chennai and in Pune and the rest of the places where you're working. Thank you again. It's my pleasure to introduce our next speaker, Dr. Abhijit Chowdhury, who is a professor and head of the Department of Hepatology, School of Digestive and Liver Diseases, IPG-MER and SSKM Hospital, Kolkata. He is a member of the Global Advisory Board on COVID-19 Response in West Bengal, which was formed by the Chief Minister, Srimati Mamta Banerjee. He leads the Liver Foundation, which is spearheading COVID-19 response in West Bengal and has been involved in multiple public health research efforts in West Bengal. Dr. Chowdhury has had an illustrious public health research career and has collaborated with Nobel laureates Dr. Abhijit Banerjee and Dr. Esther Duflo on multiple projects. He is leading the Oxygen on Wheels initiative and the efforts to set up field hospitals in West Bengal. Over to you, Dr. Chowdhury.
Can I share my, okay. As introduced by Vidya, I'm a repurposed COVID physician. I'm primarily a hepatologist, as I was introduced. But right now, I engaged myself into pure COVID activities ever since COVID came, because we thought that, you know, this is the time that we can get the best opportunity to serve at the people in distress. So I work for Liver Foundation and also COVID Care Network, which is a targeted COVID-focused NGO. And also I work for the government. So with that, let me tell you that when Vidya was telling that, you know, COVID was making headlines in media in India, and it's not that I was really feeling very happy. But let me tell you that in West Bengal, we are yet on the upswing of the COVID curve, although the crisis is really not there. So with that, I'm really grateful for the Johns Hopkins Center for Global Health and India Institute for taking this initiative. And what I'm going to tell you about is an initiative in which we have received tremendous warmth, support, and in every way enthusiasm from Johns Hopkins India Institute, and I'm going to tell you premises of that. So it's the project named Oxygen on Wheels, which is targeted. The basic objective of this initiative is to combat hypoxic crisis in COVID-19, and let me tell you that from the very outset, we have been very clear that it's not a permanent solution. It's like a stabilizing measure, because we were finding that particularly in remote areas, away from a bit away from the city, people who are living on the fringes of society, I would say the poor, the slum dwellers and all these people, and also lower middle class, and even the upper class also, were not having access to oxygen facilities and say 3 weeks back or 4 weeks back or so, as it was the scenario elsewhere in the country. And again, I emphasize that West Bengal started the second wave a bit late compared to Maharashtra, Delhi, maybe Karnataka and other states. So that's why we are on the upswing still now. So this initiative, we thought of reaching out to the doorstep of the person with oxygen concentrators. So it's like supporting the life in distress right where it needs to be supported. And let me tell you that it's purely donors dependent. And we approached, and it started off like WhatsApp requests and Facebook requests to people to donate for this initiative from Liver Foundation, West Bengal, and COVID Care Network. And we also leveraged with other NGOs across the state. So we started off with a helpline 24/7 with all our volunteers, and we are purely volunteer dependent organization, let me tell you. And we decided, as I told you, a doorstep delivery in a vehicle. The vehicle had been provided very kindly by the government of West Bengal, Department of Health and Family Welfare. We had been provided with right now 4 cars, initially 2 ambulances. And we told everybody, a SOP was drawn, and every person who was being given the oxygen concentrator by our workers who used to travel to the doorstep based on the helpline call, that, you know, we can give you this for 12 to 14 to 24 hours maximum, because these other people are in distress. So it's like a stabilizing measure before you secure a hospital bed, because there was initially a crisis with hospital beds also. And then we used to get to another person. So I'm telling you some of the figures for the first 10 days of operation. So we received in the helpline more than 6,500 calls. And you can imagine the circumstances. And I'll tell you, break up the calls. Interesting observation, and we can fragment the calls, character of the calls also. That's also a learning for us. We had, progressively increasing number of concentrators in hand. We had started off with 8, and then we, as more and more donors picked in, and I'll show you the picture of the Johns Hopkins India Institute of Donations, which has just reached us yesterday. So we could figure out that we had now got 21 concentrators at that point till yesterday in hand. So with that, I'm showing you some pictures. These are the oxygen concentrators. Our workers, our volunteers are figuring out the concentrators. These are the ambulances in which we reach out. And these are our workers are going down to the villages, down to the areas where they're giving the concentrators at the persons. They're explaining how to use that with the pulse oximeter in hand. So I'm just showing you the geographic spread of the support. Based on Calcutta, we could reach out to approximately up to 30 kilometers radius variety. So it's like, And the timing of service, interestingly, was also during the dead of the night also, almost 30% of them. And most of the requests came during the daytime. And response time was mostly, in 35% of the circumstances, the response time was less than an hour. We could reach out to the house. And in 42%, so more than around 80% was less than 2 hours. We could reach out to the person who needed the concentrator. So next slide. Yeah, so interestingly, these are very important learning for us. Let me tell you that, the types of calls that we receive, as you know, panic is a very important component, and this is also a learning for all of us who work for public health. Panic in a pandemic and insecurity is widespread. So we could see that finally 23%, because we decided that we will give the concentrator to a person who needs it. And as you know, 90 to 94 SpO2 is a place which is a window of opportunity, or below we would have loved to give them. So we could find that 23% people who had given a phone call were really hypoxic. Rest of the people were either normoxic, wanted to secure oxygen for a probable need, or had insecurity, or in panic they had called us. Our workers went to the doorstep and found out that they convinced them that we are available for you. You don't need that. Somebody else can benefit for that. Now, interestingly, we could really, I didn't show you in the very first slide, till now we could serve nearly 150 people. And let me tell you, out of those 150 people, we had just done a sort of verification of what happened to them. Only 10% did not make it. So I could say that we could save lives of nearly 140 people in these 10 days because of our workers who could reach out to the oxygen concentrators at the doorstep at least for 24 hours. So that makes all of us very happy. And let me tell you that, the warmth that you are offering to us, the Johns Hopkins Institute, and all our donors, is really gives us a lot of gratification that we can really do some service to the people. Next slide. So let me tell you that, next slide. So let me tell you that, this is a picture of India, and this is where West Bengal is. So yesterday I told you that 100 concentrators has reached very affectionately from Johns Hopkins India Institute, and our workers have been busy all through the day getting those prepared. Tomorrow we are going to send them across all through the state. So your donation, your support, your warmth enables us to reach out to the entire state. And I'm just showing you a geographical spread of the places, right from Sundarban area and Purulia. In one of those areas, we are reaching out to Darjeeling, also hill areas, and North Bengal, and everywhere we have decided how to spread those out. We are going to have Zoom training sessions with the workers in each of the places. We are leveraging with NGOs and telling them. So we are going to have reach out with all the oxygen concentrators now on in almost 20 odd nodes based on the Calcutta Center, and we are going to have a monitoring team out here, and we are also going to make an impact assessment. So that's all I had to report to you. I'm really grateful to you, and I just want to mention that I just found from Brian's presentation that you are planning to do some activities in vaccine. So We Liver Foundation has just thought of and initiated a program and vaccine access initiative in West Bengal. The idea is that beyond public sector vaccination programs, when vaccine becomes available, as you know, the biggest problem in vaccination in India had been non-availability of vaccine because of complacency by the policymakers, I would say, because they thought that the problem is gone, and that's why they didn't really make us ready to the way we could have been. So we plan to get vaccine to as many people as possible once vaccine becomes available, starting from, say, early August or so. So we are working on a model of no profit access beyond the public sector in order to complement the public sector initiative. Because let me tell you that India has got, and all of you know, India has got a very unregulated corporate healthcare delivery system, which bleeds even under the poor, bad circumstances. And that was evident during the COVID context also. So I would request Johns Hopkins India Initiative to support us also in this future program if you can, because you have already got this on the cards, and we have got very strong network with informal healthcare workers across the state with whom we work on. Liver Foundation had been working with Abhijit Banerjee and Jishnu Das of World Bank. We had published also in Science in 2016, and that has been translated into a policy in West Bengal. So we would love to get the informal health sector also into COVID action, and we strongly believe that we need to guard our villages because COVID is now making significant inroads into the villages. And without informal health sector involvement, you cannot have really good foray into the village COVID combat. With that, I thank you all for this opportunity, and we look forward to more collaborative action with the Johns Hopkins Center for Global Health and India Institute. Thank you.
Thank you, Dr. Chaudhary. That's fantastic work that you're doing in West Bengal, and look forward to continuing our work together on vaccines and in other areas as well. Thank you. I would now like to introduce Dr. Nishi Suryavanshi, who is the Deputy Director of the Bairamji Jijibhoy Government Medical College, Johns Hopkins Clinical Research Site in Pune, India. Excuse me. A PhD in medical anthropology by training, she is a senior behavioral scientist who oversees a range of HIV, TB, cohort, and clinical trials in India that range from TB implementation science to therapeutic trials involving children, pregnant women, adolescents, and adults, all impacted by TB and HIV. She conducts qualitative and quantitative research to understand barriers to recruitment, retention, stigma, mental health, adherence, and challenges faced by diverse populations in Indian settings. Currently leading a COVID response initiative at BJGMC and other partner institutions. She has more than 60 publications currently. So Dr. Nishi, over to you.
Thank you, Dr. Brian, for the introduction and opportunity to showcase our COVID support activities on this prestigious platform. Good morning and good evening, everyone. So as we know that Pune became COVID hotspot during the second wave of pandemic that hit India around mid-Feb. Healthcare systems in Pune were overburdened with COVID patients flooding in. There was like shortage of oxygen, life-saving drugs, and ICU beds, and the people were all in panic and stressed. So actually the overall situation was very much devastating. And in this period of crisis, our group decided to provide assistance and support to our partner institutions in Pune. Next slide, please. So we conducted brainstorming sessions with our coordinators and research managers, and multiple meetings were conducted with the BJGMC faculty involved in management of COVID patients. And we identified that there are 5 activities which we can do and where our help was needed. So these were like counseling support to patients on post-COVID symptom management, psychosocial support to the patients who are in home isolation, vaccine awareness counseling to people in waiting areas of hospitals, in community, and with the distribution of flyers with the answers on frequently asked questions on vaccines, and the distribution of health drinks to healthcare workers who are working in COVID wards. The last activity which we thought that it would be helpful is to create awareness about the right way of wearing mask and distribution of masks to the people who are not having these. Next slide, please. So 8 of our coordinators volunteered to lead these efforts. And we made 7 teams, and a team leader was assigned to each team. We met daily for a week to prepare counseling talking points for post-COVID symptom management and for the patients who are in home isolation, to prepare a pamphlet on frequently asked questions on vaccines. And these educational documents were prepared using various resources already available on websites of CDC, WHO, Government of India website, and CCP India. And after the finalization of these educational material in English, we translated them into Marathi and Hindi. And then our team leaders conducted training for their respective team members on the activity assigned to them. And a general training on COVID telecounseling was conducted by an international health organization, Noora Health, that is based in Bangalore. And our team leaders also created a WhatsApp group for effective communication with their teams and to track the daily activities. And our team was, our 7 teams were ready to implement these activities. But before implementing these COVID support activities, we obtained permissions from respective hospital authorities. Next slide, please. So we implemented COVID support activities in BJ Government Medical College around 10th May. And then expanded them to our other partners like On Civil Hospital, DY Patil Medical College, and 17 TB clinics in and around Pune city. 12 of them were converted into COVID hospitals. So since last 1 week, we have counseled more than 2,000 people on post-COVID symptom management, psychosocial support counseling to patients in home isolation, vaccine awareness counseling, and right way of wearing masks. We have distributed around 1,800 plus health drinks to healthcare workers working in COVID wards, and distributed more than 1,500 pamphlets on vaccine FAQs to general public in the hospitals and in the community. Next slide, please. So these are some pictures on vaccine awareness counseling and vaccine pamphlet distribution. Next. These are training activities conducted by the team leaders on post-COVID counseling and distribution of health drink to the healthcare workers in the COVID wards. Next, please. These are the counseling activities and distribution of vaccine pamphlets in the community. Next, please. So our staff is well engaged with the patients, and patients are calling them back, asking various questions. And we are also receiving a lot of positive feedback from the patients and the family members. They are really appreciating the support and the guidance they are receiving from the team. And even the healthcare providers of these hospitals share that such initiative is needed in COVID crisis to connect with the patients, and few of them have also expressed their willingness to join the initiative. So far, we did not actually face major challenges, except that some of the phone numbers we received were either not reachable or invalid. So I would like to end my talk by thanking our most dedicated and motivated team leaders. Next slide, please. So these are our team leaders who are featured here, and a team of counselors, study nurses, and attendants who are implementing these activities with our partner institutions. And last but not least, many thanks to Dr. Vidya Mave and Dr. Amita Gupta for their support and motivation, and Johns Hopkins India Institute for all the support they are providing to all the partners in India. Thank you very much.
So thank you, Nishi. That was fantastic work being conducted in Pune with all the partnering institutions of our research unit. Now we will start with the Q&A session with all the panelists. So there are people are putting in some of these questions in here. So let me start with Dr. Abhijit Chowdhury. There was a question about the oxygen on wheels. It's a really great idea, which could be replicated in other countries. The question was whether these services are free And if not, what is the payment system?
Dr. Chowdhury,
So
I believe
you're on mute. Yeah, you're on mute.
I emphatically say we hate to receive payment from people in so much distress, and for a service with which we are associated with all of you. So many donors all across the world and the country are supporting us, and then getting money from people who are bleeding virtually, gasping for breath is a crime. We strongly believe. So we don't receive any payment. And I would strongly request all of you to, tell everybody, all NGOs, that for which you don't have any capital investment, please don't take service money right at this present point of time. India cannot afford to help that. India's poor cannot afford to get that money. We don't need that.
Thank you. Thank you, Dr. Chowdhury. I think that the next question is also for Dr. Chowdhury. So I think you mentioned about a helpline, which was initiated in the beginning of this pandemic. So who are manning these helplines is the question, whether they are community workers or are there nurses who are manning these services?
No, actually the helpline is being managed. COVID Care Network had a helpline which was being manned by, primarily volunteers of different texture, I should say. There were interns who were just passed out from medical colleges. Their emotions are vibrating much more than the mature ones like us. They got involved in geometric progression into the entire endeavor. So with that, for the Oxygen on Wheels helpline, we really did not use medical doctors. In this helpline, we used mostly volunteers who are non-medical, but trained in how to react to the circumstances. They have been trained as how to reach out to the person in the even dead of the night. And a very interesting story with that I'll share with you. Now, today we were just reaching out to the peripheral areas. In Shantiniketan, we had liaisoned with a team where they came up with an idea, and it made me so happy that they told that we are going to form a team 24/7, all women team. So this is going to be an ambulance which is going to be driven by a woman. The volunteers are going to be women. So we are going to have a women's team also working on Oxygen on Wheels. So they told that this is our chance to reach out to. So it opens up different opportunities for different sectors of people. The world is so warm and so vibrant that makes us really more, gives us encouragement to be committed.
Thank you, Dr. Chowdhury.
Thank you, Dr. Chowdhury. So the next question I want to pose to Dr. Pradeep and Krish, and it's from Gauri, who asks, what are the lessons learned from the first two waves, which might help us to prepare for a third wave? And if I could add to that, what do you see as some of the remaining challenges that need to be faced where you're working through YRG Care? You're on mute, Krish. Apologies.
Before Pradeep can answer on the clinical part, from the community angle, I want to say two things. One, I still feel there's a lot of resistance around vaccination. So I think vaccine literacy has to really improve. That's one. And second is, even at this point in time, people are not very sensitive or clear about why they should maintain social distancing. And Tamil Nadu is a real example of what happened after the elections now. We're getting almost 35,000 a day. So that's where we are. And Pradeep, would you like to take up the next part of the same question?
Yeah, I agree with Krish. I think the only thing that is going to help is, I would in short call it as SMS, sanitizing, social distancing and masking, and which doesn't seem to happen most of the times. I think there were a lot of premature celebrations other than the political celebration. I mean, the political rallying that happened during elections. We also had, marriage ceremonies and things that happened in a big way. I think those should be held back. I don't see that should be relaxed anytime soon. And I think that's the only thing that is shown to be of any effect. I don't think we have a medical tool by which we can prevent. Yes, there has been a slow vaccine uptake in India, but I mean, I see that more in healthcare professionals and non-healthcare professionals. In Chennai, there is a thing that women who take the vaccines end up having infertility. So none of the nurses have gotten vaccinated in most of the big hospitals. So you have these huge chunk of nurses who are like, oh, they're okay. We take the risk of getting COVID positive. And I think, mainly just wear your mask, social distance yourself, and then wash your hands, be it soap or sanitizers, whatever you can. Thank you.
So thank you, Dr. Pradeep and Krish. So there was another question from one of the audience about if anybody is working on home isolated patients closely, accessing them every day. So does YRG Care or the Dr. Chowdhury's group, do you have any such initiative?
I would say that we don't have any structured initiative like this, but as I told you that we work with informal healthcare providers very strongly, and Liver Foundation is having programs, although not that organized, structured, dedicated program, but we are requesting the informal healthcare providers to observe them with pulse oximeters and monitor them, triage them to the facilities. And that's also, going to be upscaled across the state by the government very soon.
And,
so at YRG, we only have video consultations by which we are following them up with pulse oximeter and daily readings. We have a video consultations every other day with the participants, but we're not doing anything other than that. I think Pune, we are planning to bring in some more field work.
I just want to add that our group is calling these patients 4 times until they are in home isolation. So we have actually just started this activity, and they are asking about their health, and they are counseling them about assessing their symptoms, and in case medical help is needed, they are asked to immediately contact the doctors. But yeah, we are not actually going to their homes and doing any kind of physical examination or assessment. So it is all on telecounseling. Thank you.
Thank you. Dr. Nishi, there's another quick question, and maybe you could answer quickly from Badri, which is, what is the health drink provided in Pune? If you're not familiar, we can move on to another question, but I thought maybe we could just try and address that one quickly.
Yeah, so it depends, it is mostly the fruit juices which we are providing. Sometimes it is coconut water, orange juice, where they can get at least little relief in their, they are in PPE kits for 8 to 10 hours. And so these are the drinks we are providing when they are, leaving their duty at that time, because they are not allowed to drink when they are in the inside the wards.
Great. Thank you, Dr. Nishi. So I want to quickly go to Raghukul. So there's a question about the mechanisms available in UP to collect and analyze data from hospitals and other health centers, and to match that with community sequencing, and whether that's being done at all. I was wondering if Raghukul, you could maybe help to answer that.
Yeah, man. So, UP has got a very robust digital platform that is unified all across the state. Every notified COVID district, COVID hospital has been provided login ID and password, and they punch the time of admission and outcome of the the treatment. Similarly, every laboratory has also got the login ID password, and they directly punch their data whether the patient is positive or negative, and But unfortunately, that platform is not publicly available and it is protected. But nevertheless, it is there and it is very robust for the data collection. And our team situated in the directorate analyzes the data on a regular basis. As far as the genetic sequencing data is all about concerned, recently, with the help of the King George Medical University, they have started to do it, and hopefully the result will come very soon. As far as the dissemination of community-wide testing is concerned, UP adopted a very good model. I mean, at a regular interval, they identified some risk group like policemen, like vendors, vegetable shop, malls, shopkeepers, and all those. So on a specific interval, they conduct a drive to test all these vulnerable and risky groups, and it was I think one of the main success in the first wave to control the epidemic. I mean, government is rating it very high. So yes, and whatever data is collected, it is being uploaded in that portal. Brian, you can add if I am missing something.
No, that's wonderful. Thank you, Raghupaul.
So thank you. So I think we have 2 minutes before the end of the hour. So the final question to all of you perhaps is, one of the comments from Ms. Lakshmi is whether there are any public health messaging around decreasing transmission is needed or have been implemented anywhere in the country. So let me start with Nishi. You are muted.
Can you please repeat the question?
So, so the question was about the lockdown initially in several places like Delhi, Pune, and Mumbai reduced the transmission, and so it's now the pandemic is leveling off. But there are still some states where weddings are happening, and about 50 people are being, attending those weddings. So, is there a public health messaging that's needed, or is happening already in various areas?
Yeah, I think it is very important to for the people to understand that this behavior change is required. They need to have follow all the COVID appropriate behavior, wearing masks, social distancing. And this is important that they should be made, although they are aware, I feel either they don't perceive themselves to be at risk of getting COVID by attending these weddings, or there is like, if I have got COVID and I am cured of it, I may not get it again. And there is also a misconception that, I have got a vaccine, so I don't need to follow any kind of COVID appropriate precautions. I don't need to wear mask or follow the social distancing. So I think somewhere this awareness need to be created among people, and which is very important and difficult for this kind of behavior change, but more what I say is counseling is required in those lines.
Thank you very much, Nishi. And I think we are at the end of the hour. We would like to thank all the panelists for coming to this platform and showcasing your COVID-19 relief efforts. Thanks again for all the audience who have joined from across the world, and Brian for helping co-moderate this session. Thank you very much all.
Thank
Thank
you.
you, everyone.
Bye-bye.
Thank you all.